so many of us who struggle with dandruff. So I wanted to tell you what exactly is dandruff, how do we manage it, what are the levels of dandruff, and what can you do about it. Dandruff, essentially, most people call it dead skin, which is true to a point. So what happens is our skin always dies constantly. Our skin is born and it dies constantly. So because of hair, the rest of our body, when we bathe normally, you don't see the dead skin. But on the scalp, where you have a problem, is because of the hair, the dead skin is trapped in there. And that brings about what we call dandruff. Now, there's a fungus, a particular type of fungus, which is quite unique. It loves feeding on that dead skin. That dead skin combines with your natural oil in the scalp, which you call sebum, and then it causes irritation. There's some patients who have a severe dandruff, whereby it's really a lot and it gets very itchy. So what can you do about it? Depending on the level of how severe your dandruff is, my recommendation is, one, it's good to see a doctor first to understand the level of severity of your dandruff. Most people with dandruff, the idea, remember, is because we have hair on the scalp. So the hair is holding the dead skin in there. Getting a good shampoo or conditioner that deals with dandruff, you can start with the ones that are commonly available in supermarkets that are specific with dandruff. When you come to your barber or you come to your salon, ask them to wash thoroughly. So I like the fact that when we have salons like Sparkles, they give deep cleansing of your scalp. It's very important. It's hard to have that deep cleansing when you're home, you know? But when you are at the salon, they can have a deep cleansing of your scalp. It's very, very important. When they cleanse deeply, they remove the dead skin, so that means there's no more food for that fungus. It's very important with the shampoo that you're using. Then we go to another level. If the dandruff is still persistent, even after you having a wash every 1 to 2 weeks, consider having a shampoo that is medicated. The most common medicated shampoos have ketoconazole, so we call it ketoconazole shampoo. Others have an ingredient that we call zinc pyridinine. Good shampoos now, like the Clabin shampoo, some of the shampoos now have a combination of both. Some shampoos have what you call salicylic acid, which gently exfoliates. It removes that dead skin and unclogs your hair follicles so that your hair follicles can breathe better. It's very, very important to choose the right type of shampoo. Those who have really severe infection and the dandruff is quite a lot, I'd recommend you come to the clinic, see a doctor, get the right treatment. Sometimes they need to swallow antifungal medications and they're given higher grade, deeper, more potent medicated shampoos and lotions to help treat them. But remember one key thing about dandruff. There's no cure for dandruff. Let me repeat that. We can treat dandruff, but we cannot cure it. Why? Because the skin keeps dying. You keep having dead skin growing every single day. It's not something that you can stop. So what I'd recommend is for you to have a clear routine of maintaining a clean scalp. When you go to the barber shop, to your salon, make sure they cleanse so deeply. They usually have the right equipment. They have a deep cleanse on the scalp, which really helps a lot to prevent the irritation that you get when you're having dandruff.